prior to the COVID-19 pandemic, in our living standard research, we learned that much of the general population still doesn't understand green buildings have the potential to mitigate immediate and direct negative health outcomes. And as a result of COVID-19, we are noticing an increased desire to better understand the relationship between buildings and health. And we're also seeing an increased interest in providing better indoor spaces that will allow people to thrive now, thrive in the future, and thrive during what we think of as times of normalcy, as well as during times of a crisis. This desire to learn more about indoor environments and the complexity of the indoor environments really has the ability to transform the way that we design buildings and the way that we're managing buildings, specifically with regards to indoor air quality. Providing minimum indoor air quality has always been a requirement for all LEED projects, but the ventilation requirements in LEED were not developed specifically to address infectious disease control. And generally speaking, scientists are still learning about how viruses can be transmitted indoors and what steps should be taken for indoor air quality to limit disease transmission. So there's a lot of uncertainty about the best ways that we can manage indoor air quality, and building operators and managers are being required to make decisions about the best ways to manage indoor air quality in their buildings during the pandemic. And for LEED, we want to assist with this process, and we want to continue to encourage ways for building operators to have the information and tools available to them to optimize air quality and therefore optimize human health within buildings. The COVID-19 pandemic has also highlighted the importance of cleaning indoor environments, which at least temporarily is resulting in an increased reliance on cleaning and janitorial workers. And for LEED, we've published a special credit for the Safety First Cleaning and Disinfecting Your Space pilot credit that can be used by projects to make sure that this increased cleaning that is happening and increased focus on cleaning is not having an unintended consequence for the health and safety of the workers and of the people that are occupying the building during the pandemic.